Hello, everybody. I'm so glad you could join me today for this webinar on women's intimate health. We're going to get into the nitty-gritty of stuff today because there is no need to be embarrassed about any of this. It's all 100% normal. Oh, and we're also going to give away some really cool prizes and enter each and every one of you into our giveaway for a free Viveve session. I'll post the link to enter in the chat when the webinar is ended. Next slide. First, a little bit about me and 5280 Laser Aesthetics. I started my current business in 2016 and moved its current location and branched out back in December of 2019, where we offer a variety of services that provide real solutions for real people, including the Viveve service that I'm about to tell you about. Oh, also, if you guys have any questions, please feel free to put that in the chat below and I'll answer them at the end. I decided to add Viveve to the service that I provide because of the results that it gets. So many women suffer from sexual dysfunction as well as urinary incontinence when we are going about our regular everyday lives. And wearing panty liners and protectors each day is such a pain in the butt, not to mention sometimes embarrassing. Shouldn't be, but it is. Let me share with you one of my success stories. Let me go to the, I guess, next. Okay, hold on 1 second. I should share with you one of my success stories. Sorry about that. So I have had, several women come into me. One lady, her mother came into me. She was about to get married this summer, and so her mom didn't want to leak, anymore for the wedding. And I guess that's one of my real success stories, is that I was able to help my really good friend's mom out before her wedding without being, having to leak and have those problems an issue for her daughter's wedding. So, all right. Okay. Do you answer yes to any of the following questions? Do you leak when you do you leak urine when you laugh, cough, sneeze, when you work out, jump, lift weights, or have sex? Do you feel do you feel concerned about the clothing you wear due to urine leaks and wear panty liners to pad the issue? Does urine loss stop you from joining activities by yourself, with your friends or family? Does this sound like you? If so, are you ready to take control of your life? Next slide. You are not alone. There are over 35 million women that suffer from bladder leakage, but you don't have to be one of them. 33% of women experience urinary incontinence. 1 in 4 active females, not just athletes, but all active women who've had children experience incontinence. And get this, 40% of women suffer from sexual dysfunction. 40%. This is not 100. This is 100% normal. Stress incontinence is the most common occurring form of incontinence in women under the age of 60 and accounts for more than half of the cases. As we mentioned, anything that creates pressure on the pelvic floor muscles in your bladder may cause leakage. While pregnancy and childbirth head of the list is caused from SUI, there are other health factors that may put you at risk too. They include risk too. All right. That's all right. Women want to look and feel their best. Feminine health and wellness are no exception at some point. All women might suffer from some of the, some women might suffer from vaginal laxity, which is the loss of vaginal tightness and sexual sensitivity. This could be the result of childbirth, aging, and medical condition. Collagen and elastin, the protein that improves elasticity in tissue, along with balanced levels of estrogen and other hormones, are critical components of the vaginal health. Next slide. Okay, women's intimate health issues. If answer to any of those questions were yes, then this definitely is a procedure for you. But why exactly is it? Well, we are combining a few issues here, so let's go over them individually. First, we have stress incontinence, which is if you've had kids like me with my twins. This is that pressure that you get when you sneeze, cough, laugh, jump that may cause you to scream, "Oh crap," and then run into the bathroom, if you're like me anyway. There is your urge incontinence, where the muscles surrounding the bladder spasms and you feel like you have to go right now. When I say that, I'm like, get out of my way, I gotta go. And finally, there's vaginal looseness or vaginal laxity, overstretched tissue that's caused from childbirth and straining when trying to go to the bathroom. So think of it as a hammock. As you use its fibers and lay on the hammock, it becomes looser over time. The same with the urine wall, and it can cause vaginal laxity. Next slide. All right, cause of leak and sexual health issues. How does the pelvic floor tissue become damaged? The number one cause is pregnancy. The vaginal walls, much like the rest of the body skin, are made up of lots of fibrous materials and collagen that give the flexibility and its strength. When a woman goes through vaginal delivery, the stress of the childbirth can diminish both sensitivity and tightness of that area, which often becomes overstretched during labor. This process is known as vaginal laxity or vaginal looseness. Women often think it is normal to leak after delivery. However, approximately 6 to 10 weeks persistent leakage should be treated if you still have that after childbirth. Aging. If you don't use it, you lose it. The aging process affects everyone's body. The loss of collagen fibers makes the skin and the tissues thinner. Of course, vaginal tissues are also affected by this. Another consequence of aging is menopause, which is the phase where the estrogen production diminishes. The hormone is related to the growth, maintenance, and prepare the vaginal tissue. Menopause, about 50% of women experiencing significant vaginal laxity after menopause due to the drop in estrogen levels. During menopause, levels of the hormone estrogen drop. This can cause the vaginal lining to become drier and less elastic. The vagina can become more narrow or shorter after menopause. Also, there may be discomfort, possibly caused by the reduction in natural lubrication during sex. Health. Decrease in estrogen production caused by health issues and also being overweight. Genetics. Genetic disorders often are affecting our collagen and our metabolism. Activity. Heavy lifting, obviously, such as exercise, smoking, coughing, that goes on for a long time. And we all know that, if you cough or, kind of have smoker's cough, it can go to, bronchitis and asthma. So those are all cause of the leakage and sexual issues. Bladder control impacts every aspect of life, physical, emotional, and social. Stress urinary incontinence has had a huge effect on our quality of life. The physical and emotion demands created by SUI can leave your feelings exhausted, embarrassed, and even depressed. Some of the common products of SUI are depression. Many people with SUI are deeply ashamed of their condition and live in constant fear of having an accident. This can lead to them avoiding things once they are loved, like hanging out with friends or family, attending social events, or even working out. The restrictive nature of SUI can lead to isolation, loneliness, and depression in many that are left untreated. This can cause women to feel lack of confidence, depression, frustration, shame, low self-esteem, fear, humiliation, restriction, isolation, skin care issues with moisture. All right, next slide. So the Viveve in-office treatments. So I'm going to go over, if you do, when you come to me, how actually this is done in my office here. So the Viveve system treats the tissue using cryogen cold monocular radio frequency. It is safe, comfortable, and non-surgical treatment. Deep heating triggers the nilgolysis, provide lasting results. Collagen and the elastin are primary building blocks of a tight, sensitive, and most importantly, healthy vagina. Over time, collagen fibers can lose their useful strength and vitality. The advanced technology of the Viveve gently provides radio frequency to directly stimulate the tissue, remodeling, so reorganization, reventivation, and existing tissues. Helps to store the elastin and collagen to a more youthful, natural state. As a result, your vagina walls plumps up and provides more lubrication and sensitivity during sex. This can also improve the quality and intensity of climax and create more sensual experience if you and your partner or for you and your partner in the bedroom. So how does Viveve help with these issues? So next slide. What should I experience during my treatment day? Let's go over the Viveve treatment and how it works. Viveve is a quick, comfortable treatment performed by myself in the office here. During the visit, a small tip, which is just right here. I don't know if you can see it. I gotta go down here. So this is the tip right here that I actually use. And also kind of looks like a toothbrush at the end. And then I put lubrication on here, and then we only go, it'll kind of say the centimeters about halfway. And then after my pulses, then, we go in further and do the others, but this is, I guess, what it looks like here. Okay, about the size of your thumb. So I insert it into the vaginal opening. The tip is rotated while it alternately cools the surface and heats the soft tissue beneath. With the Viveve surface, vaginal tissue is not injured, so you can quickly get back to your normal activities, including intimacy. Your body responds to the Viveve treatment by generating stronger collagen and more realistic cushioning in the vaginal opening. Women typically begin to feel the result at anywhere from 30 to 90 days and full effect about 3 to 6 months. No medication, anesthesia, no numbing, no numbing cream needed to prep for the pre-post. Retreatments may need sometimes from between 12 and 18 months, depending on the woman and how you break down and they build collagen, within your body. And also here, I'll do like a checkup on you guys, I have in the months and just kind of see where we're at. And the reason you do want to get it done again, like anything, you have to be consistent is, you don't want it, to come back. So if you do it every like 12 to 14, 16 months, it's just, we want to prevent it, from coming back and starting all over again. Please schedule a consultation with me if you are planning to become pregnant, currently breastfeeding, currently undergoing chemotherapy or radiation, have open lesions from STI, have a large metal implant, or so those are the things. So that's on that. Next slide. All right, at-home products. There are a few home products, one of which will be given to you on your own, will be given to you to use on your own, free of charge, to help with continuing to build the muscle and decrease the spasms. The at-home products activates the strength of the pelvic muscles, like performing a perfect Kegel through the combination of high and low frequency stimulation. This calms the, this calms the detussory muscle and prevents bladder leakage and improves intimate experiences. the Attain, so let's see, this is one is the Attain, which is, I think you guys can kind of see here. So the Attain uses a soft and flexible tampon-sized probe, unique and control medical products. Inflammation customizes to fit inside your body, ensuring the comfortable and effective delivery of muscle stimulation. Our inflatable probe designed not to only maximize your comfort, but it allows active resistance to squeeze against during your post-stimulation toning workout. Biofeedback demonstrates the immediate response of your muscle activity as you are guided through your muscle toning session. When prompt to squeeze the pelvic muscle, the Attain will display a light biofeedback bar, which encourages the proper pelvic floor activation, and as an indicator, it increases the strength as you use the device. Patients complete a 14 to 26 week program with 6 sessions a week. And then you only have to do that for, it's for 10 minutes a day is the time frame. Next slide. So this one is just kind of a few testimonials I've had from clients. The first one is kind of like, I was so glad I decided to have a Viveve session with Lori. She was fully experienced. She explained what was the procedure. It made a huge difference with the increase of sexual sensation, not to mention after having children, the tightness was not always there as much as it had been years ago. Also, there was, sorry about that, also that incontinence issue with sneezing multiple times and having to cough after my treatment. I have to say I was not worried about those issues anymore. Thank you, Lori. The Viveve was a godsend for me. It helped me with vaginal dryness and bladder control. Lori performed the procedure in less than an hour, and I resumed normal activity afterwards. I would definitely recommend this procedure to anybody having these issues. It does work. So, sorry, she was 55 years old and had 4 children. The first one was 62 years old and 3 children. And then one more, I can't recommend it enough. After 2 natural childbirths combined with age, my pelvic floor was not functioning well, and my Kegels weren't helping. This correct the issue, and I'm healing, and I'm thrilled with my body. All right, next slide. All right, so 50 to 80 believes in Viveve. Viveve is safe, effective, quick, and easy, and done here within an hour at 5280 Laser Aesthetics. Get back to laughing, coughing, sneezing, exercise without fear of leakage, and get back to enjoying the most intimate moments again and make you feel even more confident. And I know I was going to kind of share a quick story of mine. I had my twins vaginally actually like 10 years ago, almost 11. And so after they came out, because I had them both vaginally and pushed so hard, I actually had the urge incontinence where I would just pee my pants. I couldn't control it and I couldn't help it. Same thing. I was like, 31 years old and peeing my pants all the time. So I did at that time have to go in and do surgery because, I didn't know any of this was available. And so obviously fast forward, 9 years later, it started coming back, even though I went in and had the surgery, I started, jumping and doing that and getting, peeing. And then same thing, I definitely have that stress, like when I have to go, I have to go. And so I did the Viveve last March on me, and then I need, to do it again because it's kind of starting to come back. Like I said, everybody's body's different, but it's amazing how you don't have to have surgery. And, like I'm saying, when you do have to pee all the time, it's embarrassing. Even me, I'm a very open person, but, my boyfriend's been amazing, but sometimes, like I said, I like just pee my pants and I can't help it. And it does stop you from going places and doing things. And I've never experienced this. Right, as bad as I am now, but with doing the Viveve and that is just, it's been amazing. And the fact that there is no downtime, you barely feel anything. It's just a little bit of warmth. I just, like I said, highly, highly recommend it. All right, next slide, please. Okay. Today, we are offering special pricing to everyone who attends this webinar. $500 off our already low price of $1,995 from now through Friday. So we'll end this on Friday, April 4th. In addition to that, we have some door prizes that we are giving out today. Can award them. I guess we're just going to announce who the winner is, and then giveaways for. All right. So just kind of let you guys know on that, and so we'll add you in, like I said, for the door prizes, and then for a free, someone will win a free session with the Viveve. All right, next. Okay, let's do this. So obviously this is all my contact information, and now I'll take time and go through the chat if I can answer any questions. Just thank you guys so much for joining today and doing this. Is my first time, so just thank you. I look forward, like if any of you needed, obviously a free consultation, and I'm looking forward to hope you guys take advantage of the really good pricing I have on now. And I guess if we had any questions in the chat room, and I just want to say thank you very much for attending this.
Awesome. Yep, we do have a question from Susie.
Okay.
You did great, by the way, Lori.
Thank you.
Susie wants to know, she had a hysterectomy and bladder mesh sling installed. Will this treatment be okay? Any contraindications?
So this might something with Megan. You should be okay. I've done, I think, 2 or 3 people, with the mesh, and even though you've had that, because that's what I had. So even though I have that done, and I hope I'm explaining this right, I can still, go in there, because are you having symptoms that are coming back?
She hasn't responded yet.
Okay, because if she is, like I said, if anything, you have to be consistent. But even though she has the mesh and everything in there, she can absolutely do the procedure, the treatment.
Okay.
Did I answer that correctly?
Also, she can ask the Viveve team. So,
and I will send her, I will ask Megan, you know what I mean, 100%, but I just always re-ask sometimes, just because, I'm still learning, but I've done several clients that had the mesh already.
And Susie said yes.
Okay.
All right. So Brianna, is it Brianna? Has a question. Do we need to make a consultation appointment, or is therapy the first appointment?
So I really like the consultation to do that first. You can come in here and we can even schedule for you that day if you want to go ahead and have the procedure. And if you're not sure and just want to have a consultation, and for the therapy, we can kind of combine that all in one. Depending what you want. Some people just want to come in for the consultation and then make an appointment, which is great. So, truly whatever is you're comfortable with.
Awesome. Okay. So we're going to announce a winner for the door prize. I have some software that I use to pick an attendee at random from the multiple attendees. So let's see. I'm going to put the names in here. And it looks like we have Susie is our winner.
Yay, Susie.
Susie, you win an awesome door prize. What door prize did she win today?
I think that we'll go ahead.
I just wanted to know if you had a door prize picked out, or if we had just one we were going to email them about.
We can just, I was going to do a $25 off, like gift certificate.
Excellent. Okay, so Susie, we'll be sending you an email with information on how you would like to claim that. And if there, she says in the chat, I told you I would win. And Brianna says, awesome, thank you. We've been talking about it for a year. So I just need to pull the trigger.
Okay.
And I'm going to put the link for entry into winning a free Viveve session into the chat. So everybody make sure to grab that link and enter that. All right.
Okay, any other questions? And like I said, thank you guys for coming today and listening. This is very, I love this machine. Obviously, I love this treatment. So many women out there that don't know about it, and a lot of people are uncomfortable, and of course I am not, but I just, we don't talk to our friends like, oh, hey, do you pee when when you laugh? Like, is sex uncomfortable? Are you dry? But, just the more women we can tell this about too, and the more women we can help, out there. And we are going to be doing, just several webinars just to keep up on this, and, just to get out there and let women know that there is a amazing treatment out there for everybody.
Awesome. Pam did have one more question.
Okay.
Do you offer anything for men?
At this time, no. I know, because I know someone had asked that a while back, and so far, no, on that I know of. And same thing, Pam, I'll kind of ask Megan, you know what I mean? Just if there is other things out there, if there is something out there for men, but as my knowledge, there is not.
You do have lots of other services at your place though for men.
Yes.
Besides, yeah.
Yes, correct.
Okay.
Yes, I do all my services I do truly are men and women, except for this one. This is about the only one, obviously, you can't do as a man.
All right. So if anybody has any questions, what's the best way to get a hold of you?
Honestly, the best way, I'm such a phone person, so you can see my cell is 307-389-2498. The best way is to text me. You can call. If you call, I'm usually busy during the day, so you can leave a message, but I will get back to you. But I like to personally talk to people on the phone, but if you're a person that texts, whatever you would like to do is fine with me.
Excellent. All right.
And like I said, go back to Megan and just double, check all everything I told you guys, just to make sure things do change, but I'll just double check with her.
All right. Great job, Lori. Thank you so much.
Thank you. Thank you guys very, very much.
All right.
All right, everybody, have a great day. Bye.